In this video, we're going to explore 3 more paths to experiment with to help climb out of a dark hole. Number 3, accept some extra support. Many of us feel too embarrassed or ashamed to reach out for help and say, "I'm struggling." So we try to do it alone as much as possible. But if you're feeling stuck, helpless, or on fire, then these are good times to lean on others. We can lean on healthcare providers for assessments and treatment. We can lean on a spiritual community or perhaps open up more with our friends, family, or colleagues. We can ask for some help with a couple responsibilities or request temporary adjustments with what's on our plates. We might give ourselves permission to access community resources that are out there to help minimize a little bit of our suffering. It's so hard to communicate our vulnerability, but we are a social species like insects, birds, and mammals. We rely on our communities and one another. So do what we've been doing since the beginning of time, needing one another, supporting each other. Lean in especially to relationships with people that uplift you, that have your back, that don't drain you or mistreat you. Number 4, force yourself to do things despite little motivation or rewards. This is one of the most annoying things to hear when we're feeling stuck, but it's the truth. When we're in a dark place, our pleasure and motivation tank is extremely low. So it's really important to force yourself to do things for a while, even if they don't feel enjoyable, even when you have low motivation, and even when you don't really notice the benefits quite yet. It'll take time to fill our tank again, but every step we take nudges us closer and closer toward wellness. Challenge yourself to do at least one productive thing each day and at least one pleasurable thing each day. So instead of feeling immobilized by the 50 things you know you need to do, you're narrowing it down to something much more manageable. When we set small, reachable goals, we set ourselves up for success, for more opportunities to boost our self-esteem. You can also celebrate small successes and reward yourself for your efforts. So, for example, if you've been putting off making an important phone call and finally muster the energy to do it, treat yourself to a favorite snack or give yourself permission to delay a chore one more day or whatever. Force yourself to do things that get your body moving. Going to the gym or dancing alone in your room is too much, go for a walk outside with headphones on or do a brief yoga video. We know that physical activity not only helps us care for our bodies, it also produces chemicals in our brains that nurture our mental health. Challenge yourself to keep experimenting with different coping strategies, even if you're disappointed with the outcomes at first. Trust the process and not the thoughts that are trying to convince you that you've tried everything and nothing will help. That's your suffering talking, not your inner voice of wisdom. The benefits and rewards of your efforts will come as these actions grow into habits. Number 5, consider medication, therapy, or both. And if you already partake in these treatment options, consider making adjustments. These interventions might not be for everyone, but they can be especially helpful when we need that extra push to get above ground. They don't mean you're a failure or that you're weak. And while they can't obliterate all suffering, there are medications that can help turn down the volume and intensity of some symptoms. There are therapists that can help you nurture your self-esteem and process life events and practice skills for navigating challenging emotions. Many of us feel ashamed and too embarrassed to reach out for extra help from others. We're afraid of other people's judgment. But if you've written off these treatment options in the past, it's good to revisit the questions: should I give this another try? What do I have to lose? We've explored 5 starting points for climbing out of a dark hole. There are, of course, other options that people find helpful, like getting into a habit of journaling or making a big life change we know we've been avoiding, or living a life that aligns more with our values. Regardless of which paths you take, be sure to pat yourself on the back for your efforts, and remember that your true self is separate from your depression, from your thoughts, and your suffering. May this rough patch be an opportunity to strengthen some skills and grow.